What is COVID-19 and what can we learn from the coronavirus? This video is made for those who wish to better themselves and the world by using the event as a catalyst for intelligent and effective decision making and lasting positive change. What we know so far. An outbreak of a cold-like illness began in Wuhan, China, which has a mortality rate of about 3% in China, but that number depends on age demographics and appears to be less than 1% in some areas of the globe. The WHO also reports a 0.2% case fatality rate in people under 50. Symptoms include fever, dry cough, sore throat, fatigue, and in some severe cases, pneumonia can occur. 208,000 cases globally, 8,000 deaths, and so far over 70,000 people have recovered. Those who become infected generally experience mild illness and recover in about 2 weeks. Who seems to be affected? The WHO reports most severe cases in people who are older or who have underlying health conditions. Remember that phrase, underlying health conditions. If you are not aware, we have had outbreaks like this before. Spanish flu, 1918, passed from birds to humans. Humans developed some immunity and the virus went dormant for a period. Then this virus combined with another flu virus and we had H2N2 outbreak in 1957. Then the Hong Kong virus. Today, the great-grandchildren of these viruses are what cause our influenza. This just happened with avian flu quite recently, which had a much higher mortality rate. Also 10 years ago with SARS, which came from civets. What happens is, for example, a wild bird comes in contact with a poultry farm, a chicken farm, and the wild virus passes to the livestock and eventually to the farm workers who are in close contact with all of these animals living in extremely close proximity. Have you ever seen a chicken farm? COVID-19 began in Wuhan, China, at a wildlife animal market where wild animals are butchered on site and sold for food. Animals are caught, bred, kept in small cages together, and butchered in an inhumane, unsanitary fashion. As if you could breed, imprison, and murder an animal in a humane and sanitary way. That's a joke. You can't. We understand the virus first originated in bats. Sources are not certain yet which animal first transmitted the virus to humans. However, it is speculated to be the pangolin, a critically endangered animal which the Chinese consider to be a delicacy. I mean, come on. How can you eat these guys? Bottom line, we know now that if people weren't raising animals for food, we wouldn't have heart attacks, to a certain extent diabetes and certain cancers. Now with infectious illness, this is exactly the same story. The discussion on infectious disease needs to center around the animal agriculture industry. Why? Because that's where the viruses come from. It seems only rational to address the cause if we plan on preventing these situations in the future. The markets in Wuhan are all too similar to chicken, pig, fish, or cow farms in the Western world. This is the perfect environment to breed and transmit disease. With these animal manufacturing practices, we should expect to create and cause disease. What can we learn from COVID-19? Unhealthy people get sick and have a hard time getting well again. Healthy people don't. As with other infectious diseases, chronic illnesses raise your risk for infection and serious complications. Overweight and obesity cripples the immune system and affects 70% of the US and Puerto Rican population. Diabetes and poor blood sugar control also deteriorate the immune system. Diabetes is also the 4th leading cause of death in the world, killing 3.2 million each year. Heart disease kills almost 18 million each year, and yes, it does elevate your risk for serious complications from viral infections. Cancer kills almost 9 million, and cancer drugs virtually destroy the immune system. Autoimmune diseases, systemic lupus, multiple sclerosis, psoriasis, ulcerative colitis, rheumatoid arthritis, Hashimoto's, or conditions which alter immune function and response, such as asthma, allergies, hypothyroidism. All these conditions put you at exponentially greater risk for a coronavirus death. Even taking the drugs to control or manage these conditions puts you at greater risk. This includes biologic drugs, steroids, and anti-inflammatory medications, among many others. Let's focus here a bit. Well, what should we be doing to stay healthy so that even if we get exposed to the virus, we are healthy enough to deal with it efficiently and effectively? The Global Burden of Disease study tells us exactly what we need to pay attention to if we want to improve our overall health. The Global Burden of Disease study is a comprehensive study that describes the mortality and morbidity, the state of ill health, based on risks to health. These are the greatest risk factors for all-cause mortality. They apply to risk for infectious disease as well. Eliminate high blood pressure, the #1 contributing cause of death in the world. At least 103 million Americans suffer from hypertension. Blood pressure is easily normalized with dietary and lifestyle changes or a 1 to 3 week supervised water-only fast. Smoking and drinking. Of course, you're much more susceptible to a virus when you're using drugs. The rest of these are mostly problems with our diet, which just so happen to cause high blood pressure and many of the other chronic conditions, such as we mentioned before. Low in fruit, low in vegetables, low in nuts and seeds, high in cholesterol, high in sodium, low in whole grains, and of course, physical activity. So, what can we do now? Well, the media has scared everyone enough to get them to buy up all the face masks and toilet paper, and your local government tells you you need to stay at home and wash your hands. Fine. So, we are left with a feeling of hopelessness. Guess what? You are in control of much more than you believe you are. Your body, when treated properly, is infinitely intelligent. We are dynamic, adaptive organisms which deal with viruses quite well on a daily basis when we live within the laws of nature. We control our own health, and it starts with a healthy diet, but it doesn't end there. Get outside. Allowing the sun to stimulate your skin and our many other glands primes our immune system. Breathe fresh, non-conditioned air into our lungs. Moderate exercise and activity during the day enhances immune function as well. Do some gardening, contact the soil, walk around with your shoes off, hug a tree, hug another animal. Staying away from germs and being excessively clean certainly won't allow us to develop immunity to anything. The immune system requires regular, consistent practice. If you don't have pets, get some, or ask your neighbor if you can walk their dog. If anything, the dog will appreciate it. And don't tell me you can't eat healthy during a pandemic quarantine, because I've been to the stores, folks, and I will tear that argument apart. What are people buying? Cow's milk, eggs, cheese, bread, processed meat, packaged cereals, chips, salchicha, corned beef, pre-prepared frozen meals, salted trail mixes, cows, chickens, pigs, fish, spring rolls, frozen pizza, sodas, juices. If you didn't have cancer or high blood pressure or diabetes before the pandemic, watch out. These are pandemics which have been around for over 50 years, and the death rate continues to rise, reaching around 30 million people every year. Is everybody getting this? 30 million deaths every year, and we're racing to develop a vaccine for a cold? A cold, which has a 3% or less fatality rate. A virus which is most virulent in people with heart conditions, cancer, and diabetes. Doesn't this sound like the dog chasing its own tail? You can find everything you need at the supermarket. Fresh, frozen, or canned vegetables and fruits. People hardly touch them. Brown rice, beans, and lentils, potatoes, sweet potatoes, raw nuts and seeds. My diet hasn't changed a bit. Need to stay at home? Avoid gatherings? Great! Now you finally have time to eat healthy, exercise, meditate, go to bed on time. Use it. Everyone complains that it's too difficult to practice healthy habits, right? They don't have time. Well, bars and restaurants are closed. Concerts are canceled. Super! What better motivation to give up drugs and alcohol and learn to cook? One door shuts and 10 others open up. This is the moment to sit down with your child, your husband, with the rest of your family and reevaluate how you live for the benefit of not only your family, but for all the fellow inhabitants of the earth. Our fasting patients are extremely happy to be at our residential center during this time. They avoid contact with infected people. They don't have any responsibilities. They can rest as much as they want, enjoy our educational program, and receive the amazing benefits of fasting. Fasting can not only reset and enhance immune function, but it also addresses the underlying causes of chronic illnesses such as hypertension, diabetes, cancer, and autoimmune diseases. It turns out, in order to survive this pandemic, we need to address the elephants which have been in the room for over 60 years. Our reliance on animal agriculture and our poor diet and lifestyle.